Welcome to Direction Northeast. Hello, I'm Kid Alexander. This program is a presentation of the Communications Department of Northeast State Community College. This episode of Direction Northeast takes a look at therapy dogs and how they are helping hospital patients deal with illness. We'll meet our guest and start our discussion right after these messages.
Over 10 years in investigations.
25 in heating and air conditioning.
15 years in the automotive industry.
22 in computer science.
23 years in healthcare.
An engineer.
A biochemist.
A chemist.
An award-winning author.
Northeast State professors bring experience to the classroom, a personal education from a professional. Classes when you need them, where you need them. More than 150 programs. Visit northeaststate.edu. Northeast State Community College. We're here to get you there.
Our guests for this edition of Direction Northeast are the two-legged and four-legged variety. While our four-legged guests rest, we introduce Barbara Clark and Janet Stastny. Welcome to Direction Northeast.
Thanks for having us.
All right, so I wonder if you could start out by telling us who's our guest here? Who do we have?
Well, this is Lily Mae. She is a golden doodle. She is 6 years old. And if she would turn around and everybody could see her, which she might do during this interview, she was on part of the cutest pet fundraiser here that was at Northeast State about 2 months ago. And I think she's in the May calendar. So.
All right, so this is Lily then, and who do we have over here?
This is Moses. He's an Australian Labradoodle. He's 5.5 years old, and he's been working as a therapy dog since about a year old.
So what is a therapy dog? I guess if you could describe it that way, and what are the qualifications for one of these to become a therapy dog?
Well, a therapy dog just helps people feel good about themselves. They can lower your blood pressure. They'll lower your anxiety levels. They can do a lot of good things for you just by petting them. To qualifications, there's 3 national groups. And those national groups have different qualifications. Most of them are about the same. Mostly the dog has to be a year old. They have to have that nice personality where they engage with patients and they just like being around patients. They have to be able to have that nice personality. They have to be able to walk on a leash close to you so you don't go 20 feet in front of you. The Alliance of Therapy Dogs, where I belong, the national group, they require the dog to have a test. The test just is showing how you and the dog work as a team, how they work walking on leashes, how they interact with other dogs, because sometimes there's other dogs, places that we go that are not therapy dogs. And so they have to be able to tolerate that. And then after the test, we have observations, which are at least 3 to 4 of them, where we take them we have a group that we run. We go out on Tuesday and Thursday nights, and we'll take the dog with us and see how he does with the hospital equipment and all the different smells and how he just interacts with people. And then once all that's done, they have to have up-to-date shots, and now we're requiring a background check on people. And once all that gets sent in, our national office is in Wyoming. And once that, they have committees that approve of all the forms that the tester fills out. Like I'm a tester for Alliance of Therapy Dogs. So once we fill out all the paperwork, we give it to the person, and I think it's about $30 to send in with your application. Once they approve you, you get a little red heart for your dog to say it's a therapy dog. We get a card. Every year, wherever we go, we have to provide our shot records and a copy of our national card. We get $5 million of insurance on them if we're working as a volunteer in therapy in case there's some problem with, like say if they bit somebody or some accident that they caused. And so that's mostly the qualifications.
So y'all can take these like in nursing homes or hospitals and schools, you know,
Right.
people that really need to see them or folks that have disabilities, I guess, if you will, and then y'all can bring them in and helps them out.
Oh, absolutely. In fact, just over this last month, the National Animal Humane Society in the educational department was going out to elementary schools just to teach kindness for younger children that may not be familiar with how to take care of an animal or how to even approach an animal. So they called on us to have a dog represent what they were trying to teach. So yeah, going into schools and going into libraries and having children read to them in the libraries.
So are there like particular kind of dogs? Like does it have to be just this breed or a particular kind of dog that actually can serve as a...
Actually, it doesn't have to be just a dog. It can be any kind of dog. It can be a big dog. It can be a little dog. It can be a pit bull. It can be a chicken, actually. It can be a rabbit. Miniature horses can be therapy dogs.
Yeah.
There's a whole gamut of different types of animals that can actually qualify. It's just a matter of the testing and the organization that you would belong to that would allow the different types of animals.
So would it be a different process, or do you know if it would be a different process like for a dog to become, therapy dog versus like, another animal? I mean,
Yes, there would be different ones, and I'm not familiar with the other animals just because I don't know that our region technically really
It does out of Knoxville.
has that.
Knoxville, the vet school at UT, they run the Delta Society, which is the now called Pet Partners, and they will test other animals. Our national groups that we belong to only do dogs, but the vet school, you can apply to over them, and they have their own test depending on what type of animal it is.
I've seen these, and I used to work at Sears in Bristol, in the Bristol Mall, before they closed, and I know several times that they would bring in, therapy dogs, or service animals or whatever, and so I wonder. I mean, it's made by law, like they're allowed to go into different businesses.
Oh no, pet therapy dogs are not allowed to go just everywhere. There is a difference. There is a service dog, and those service dogs are trained to do something specific for the person that has the disability. Therapy dogs are dogs that just go out into the community and make people feel good. These are pets. A service dog is, yes, they are a family pet, but they are trained to do a specific task for the person that has the disability. Ours are just to go out and feel good. Ours are pets, so they're not allowed to just go anywhere. Now, for us to go to the hospitals or the assisted living, like Janet said, we have to provide ahead of time their vaccination records in our card, just in case there is an accident, that they are covered by insurance. But the service animals, that's a whole different thing. And we were talking earlier, and there's becoming a real abuse with the service dogs. People are purchasing those vests online, and I could walk on in here and I could have had that vest on Lily, but that would have been, it's technically illegal, but I don't know how the crimes are being punished really, because that's false representation. She has not been trained to do anything specifically for any kind of disability.
So I wonder too, could you tell us about the national group of therapy dogs?
Want to talk about yours?
Well, there's two different ones really locally that are here. There's Therapy Dog International, and then there's the Alliance Therapy Dog. Those are really the two local ones here. I think Kingsport is really more of the Therapy Dog International, and they really go into the hospitals locally. There's a big group. I think there's 100 dogs that go up to that hospital. And then the one in Johnson City, the Alliance Therapy Dogs. But your group is even more in specific, isn't it?
Well, we use mostly Johnson City now, but we used to go to Holston Valley and Bristol Hospital as well, but we were going out 8 times a month and it got too much. So, because we all worked at that point. So now we've only go out like 4 or 5 times a month. And we do a lot of special visits, like to ETSU or to colleges to de-stress students before their finals. And Moses is a read dog, so like Saturday we're going to the Johnson City Library and the kids will read books to him. They also have retirees who actually go into the school system, and they have individual teachers that will give special ed kids or special kids that are having trouble reading up to 3rd grade. They pick the worst kids in the class, and then they bring them to the library and they read to dogs. And by the end of the school year, they're the best students in the class. So it's fun to see how dogs can really change stuff. 2 of the men in our group actually go to the Veterans Hospital, and they're in the locked PTSD unit. And they tell me stories about how the veterans who won't talk to anybody talks to their dog, though. So the doctors are thrilled that that the dogs are bringing these people out of their shells.
Janet, can you also tell us about the Alliance of Therapy Dogs, or formerly the Therapy Dogs, Inc., Incorporated?
Yeah, they're based in Wyoming. They've been around since the early 1990s. They're pushing each other out of the way here. They're basically, they have about 15,000 dogs that are certified through them. And we went through the process already of what we do. In our area, there's 4 testers for Alliance of Therapy Dogs. I'm one of them. So we can test dogs to become therapy dogs. We don't make the final decision, though. It goes through the national group.
And if we could maybe touch on that national group, Janet, if you can maybe speak on that, Therapy Dogs International.
Well, Barbara belongs to that group.
Well, Therapy Dogs International, it's really about the same thing. You go into a test, they would like your dog to go through a basic obedience class first. And now I think they have started to reach out and have you go through another set of classes. But as Janet touched on, it's really, if you're at all thinking about doing therapy work, one of the biggest parts is, you may say, oh, I have a great dog and I want to share it with people. The dog has to have the personality that it wants to be shared. It needs to have that personality that it walks up to people. I think when you all realized when we got here, it really wasn't about us being here. It was about the therapy dogs. They walked up to every one of you. So it's following the lead of the pet first and foremost. The obedience is, the sit, the stay, the leave it. The leave it is very important because if you are in a hospital environment or a nursing home, somebody may try to give your dog a treat. That treat could be medicine. And that's the last thing you want your dog to do is take something from somebody. So it's some of the simplest commands can be the most important commands. But as the volunteer, we're called a team. And as the volunteer, yes, my dog is doing her job, but there's a lot of interaction. As Janet said, sometimes, like that PSD patient was talking to the dog, but yet I'm in the background to have that small conversation. And so some of the things that you encounter are things that you would not normally encounter. You may not be ready to encounter some of these things, but some conversations are difficult and some situations are different, but you just need to be there for that person. You're not there just to share my dog. It's a bigger picture than that.
And Barbara, you mentioned this too, about them, greeting us as we came in, which is so true. They were, pretty much all over the stage, greeting everybody as nice as they could be. But you also mentioned too about other animals, like example, maybe rabbits or miniature horses and stuff too. Tell us a little bit more about that, because like you said, it doesn't have to be just, dogs.
Yeah, well, Janet talked about habit, or it's the Delta Society, but I think their initials are Habit or something like that.
Now they're Pet Partners.
It's Pet. They changed their names. Yeah, there always ends up being everything's always morphing and changing when it comes to the names. But they have developed more of that type because they don't really have like dogs, they know what a normal behavior should be versus the abnormal. And so when it becomes a chicken or the miniature horse, I guess some of those, they have fine-tuned what those normal behaviors would be.
And Janet, could you tell us a little bit about that? Pet Partners, which was previously the Delta Society.
Well, actually it started like in the 90s as well, and it's actually veterinarians started it, and then they had one psychiatrist notice that animals were engaging people and they were lowering people's stress and their moods got better, and so that's why they started the Delta Society. And it's changed its name several times as well, and now I think they're calling them Pet Partners or Habitat or whatever. But all kinds of animals can be in there, like Barbara said. I've seen rabbits. We see a miniature horse that goes to Bristol Hospital. We were there one night, and we're all looking, and somebody said, "That's an ugly dog back there." And I said, "That's not a dog, that's a horse." It was a miniature horse. But they have to go through special testing, and each type of animal is tested differently, but the vet school does that, and so but they do the same thing as us. We go as long as they engage the patient, that's fine. I've seen cats and I've seen rabbits be therapy dogs, and most of the time they hold them Now, they can't go with our groups because we're strictly dog-oriented. And we would have problems maybe with cats, at least mine would. They would chase them, you know.
Yeah.
But I have seen them at the nursing homes with rabbits in a blanket where they hold them and stuff. And the patients love them.
So when you mentioned pet partners, Janet, this is like your local pet partners, right? Like, you know, we have one in Bristol where I live. You know, so a person could go there and you could see this or get in touch with somebody who would know.
Right.
Why should a person become, Janet, a member of the national organization as a whole? Why should they be a member?
Well, for one, they have criteria that, you know, that we jump through hoops in order to get into a hospital or nursing home. They won't just let you bring your pets in most of the time. And so we have insurance on the dog in case something happens, but they also have to go through rigorous testing to make sure that they're the type of dog that are going to be good as therapy dogs. We're not just bringing some dog off the street into the hospital. I have seen that, and there's been problems when the hospital allows street dogs to come in into the hospital. One of the hospitals in Johnson City, nurses got bit by several of these people's dogs. And so they banned all dogs, and we had to go and talk to the administrators to make sure that we could come back and that our dogs are specially trained just for that. So belonging to a national group, we also get a lot of information from them, and we have strict rules we live by. So I think it's a important thing to be in a national group.
And Barbara, also, if you could tell us maybe a little bit about that, just, you know, from your perspective.
Oh, I mean, everything Janet said, I mean, it's exactly what Janet said. You know, the main thing is really, you have to keep your animal up to date on vaccinations. There's no getting around that. So, you know, any animal that is a therapy dog, you know that it's taken care of through the veterinary process. You know that they're covered by insurance. So if there happens to be an incident, I've never heard of any, but if there is, you are backed by the insurance policy. And just knowing every dog, every owner, every team is what we're called. We all know the rules. And so you don't have to correct anybody, and it's just, you know what's expected of everybody. It's a professional situation.
And Janet, as a team, I wonder if you could touch on that. What would be like y'all's involvement with like schools? You know, schools like Northeast State, you know, community college.
I'm going to jump in on that one.
Okay.
In fact, April 10th, we're going to be here on campus. We are going to be here for the de-stressing for the students for their exams. We'll be out in the courtyard, I guess, starting at about 11:30. We'll be here. So I'm looking forward to that one. So any student that is just wanting some downtime, come enjoy the adventures that the counseling department is hosting.
And ETSU, we're going there April 25th from 11 to 1. We go into the library, and they have us in the back section. And we had 300 students the last 4 or 5 years come and pet 10 dogs. And if the weather's nice, we'll be out in front of the library and stuff. But it really, most of the kids will tell you that they feel so much better just sitting around them and petting them because they don't get to bring their pets to college. And so this is a nice release for them to have a pet around that's well behaved, that just wants to be loved on. And so several people told me this was the best thing, and they did well on their finals because we brought the dogs in.
It's always fun to go to those things when they don't even maybe realize that they're going to be there, and you just see that face, the smile that comes over them. I mean, literally, their backpacks get dropped. You just watch them kind of drop and come over, and it's kind of like you just left your personal belongings behind you, you know. But when they see you just watch that stress, it's gone. Mm-hmm. It's absolutely gone. And even that's how it is in the hospitals. Yeah. I have been to a surgery rehab center, and there was a lady from a different country, and she was not familiar with animals. So when I'd walk by, she would scream. It'd be like, ah! Oh, you know, didn't want me to come anywhere close. Well, as I kept coming, you know, week after week, she was still there. Finally, she got to the point that she would do that. And it was just, you know, the nursing staff was just joyous because they knew these dogs. So it was, over time, just to watch those faces, people smiling. And in the elementary schools, the reading programs, like I said, just how to be kind to animals. It's just wonderful to teach children.
Makes all the difference then. You know, they see the pets come in, and then, like you said, the stress just, you know, melts away.
Yeah, completely melts away.
Well, we also started going to Appalachian Christian Camp. It's some of the physical therapists run a weekend just for special ed kids. And the kids, some of them are ADH where they're running around and they don't sit. And so we come in at lunchtime and calm them down. And it's amazing to see how the kids will just sit and pet the animals. And then they have the whole afternoon to get all excited again. But it's a nice release for them to see about 8 or 10 dogs there just with all these special ed kids. Moses found a little girl with crutches and braces on her legs, and he was taller than her, but he would just stay next to her and just kiss her on her face. I mean, and she just kept petting him and say, Moses, I want to take you home. It was cute. But I mean, it was just a nice release for the kids.
So what kind of activities does our group, you know, do as far as distressed college students, you know, prior to finals or performing reprograms? You know, so what do these activities, what do the groups play a part? What part do they play in that?
I don't know.
You got us at a loss.
Yeah, that one's,
Well, I mean, they really, I mean, the benefit for having a therapy dog is to, one, lower your blood pressure. It will cause anxiety levels to go down. People's moods get better when they pet a dog. They just seem more happy and more glad. And so there's been written reports that that cardiovascular diseases, people do better. For one, you have to walk your dog, even if you own a dog. It doesn't have to be a therapy dog, but you're walking them all the time because they need exercise, so you're exercising. So I mean, there's a lot of reports that say that having a dog is a good thing because it makes you get out and do things, like even throwing a ball for them, and you're just a little bit more active. But therapy dogs just help more make people feel good. Like I said, lower their blood pressure, their stress levels. It's just a nice release for them.
And Janet, does y'all's group in particular, do you know if do y'all have involvement with the Appalachian Christian Camp, if I get it out right, the Appalachian Christian Camp for Special Ed Children? Do y'all have involvement with that?
Yes, that's what we just talked about. Yeah, we go there like once a year in the summer. It's usually in the fall when they have that. When the regular camp kids are all gone by September, they'll have the special ed kids come in, and that's when we go and visit them. And so we do that. And we do a lot of festivals at ETSU. They have a health festival that will be outside, and they have all these booths to help the kids learn about health and what's the good things to eat.
They had a homesick week for a while when kids would, about 2 weeks after kids would come to college. I think they were finding out that was kind of getting to be that dropout rate. And so, you know, kids just kind of not quite fitting in, so they had us come in, and, you know, some of that was just to help to calm them down. Talking about the therapy part, one of my dogs, Max, I did take him into the surgery rehab facilities, and he was kind of being used as a modality, and that would be a therapy modality, which if somebody is learning how to walk again and they're on a walker, we may have laid his leash over the walker, so they're thinking they're walking Max, where he's just walking along with it. They're not thinking about the pain or about balancing. They're thinking they're walking the dog. You know, if something was to happen, the leash would have just slipped out and it would have went away, and there wouldn't have been an incident. There was kind of a priceless moment where there was a gentleman that was in his wheelchair, and I was going down the hallway, and he stopped, put his brakes on, and he stood up, and the therapist was not ready for that. She's like, "What are you doing?" He goes, "I want to play with this dog." He hadn't stood up yet out of his wheelchair, so she was just like, "Oh my goodness." And then she realized she can start timing him on his balance and standing up and throwing that ball for Max. Now, that's a little bit different. That's not what our dogs are really trained for. That's in a therapy situation. Those are called modalities. But like in Atlanta, they do that at a lot of their hospitals. Mm-hmm. But us as volunteers, we're not getting paid, but that could be a chargeable physical therapy type of thing. I've had shoulder surgery, and for me to have to take care of my dogs, brushing, just that brushing, that was a big part for me of having to get them and getting up to go to the bathroom. So it's all those little things. they make you do things.
So that'd probably be a different process they would have to go through, I guess, for
To
like
get
a
the
bigger
training,
market.
yes.
For like Atlanta or, somewhere.
Right, right. And it also takes the dog. I have different dogs that like Max, to throw the ball for Max, if it was to roll under one of the cameras right there, Max would run up to it, he would stop and he would look at me like, I know I'm not supposed to get that ball. Now, Poe, he might knock everybody over to go get it, so it's all in the personality of the animal.
So I know you mentioned this, Barbara, at the very beginning, and this is so true. You brought up a great point. What is the difference with the therapy dog versus your service dog?
Yeah, it really covered that in the aspect of ours cannot just go anywhere. Our therapy dogs they're a feel-good dog. A service dog is a dog that's been specialty trained for a specific need, whether it's seizures. The dog could come stand over the top of somebody, or it could lay underneath somebody so the head won't hit the flooring. It could be a diabetic dog that can start to sense the different pheromones that somebody's producing. There are the very common now is the autistic children, just trying to keep the child from going in the road. The dog can be trained to not allow the child to go into the road, or for calming. But those are dogs that are trained. Some of them are more expensive due to the extensive training that they need to, but that's where people are a lot of times raising money for service dogs.
Well, Barbara and Janet, thank you so much for being on the show and for bringing your guest here, Lily. Thanks,
Yes.
Thank you. We'll be back in just a moment to wrap up Direction Northeast.
I've learned a lot of things in my life, but there is no substitute for hard work. If you've got the will and determination, doors will always continue to open. Life puts us in the driver's seat. Where we go and what we accomplish is up to us. What's that old saying? When the going gets tough, the tough get going.
That concludes the program for today. We have talked to Barbara Clark and Janet Stastny using therapy dogs, 10 hospitals. Community is very important to the students at Northeast State Community College. And this program takes a look at a few of the subjects that they find important. Until we meet again next time, on behalf of the students, staff, and faculty of Northeast State Community College, I'm Kid Alexander, and this is Direction Northeast.